Knock, knock, knock. Hi, I'm Hannah. I'm going to be your student nurse today. Doctors have orders for me to place a Foley catheter in. Can I get your name and your date of birth? Okay, so it checks out with the wristband. I'm going to go ahead and wash my hands and provide some privacy for us. Do you know what a Foley catheter is? You don't? Okay, so a Foley catheter is a little tube that is inserted into your bladder that will help that urine come out. Are you allergic to betadine, shellfish, latex, or tape? You're not? Okay. So I'm going to go ahead and put some clean gloves on, and I'm going to ask my patient, is it okay if I touch you? And it is. So I would help my patient get in the lithotomy position, and I've got a little water bottle right here if y'all can't see that. I do not have my little white box for my kit, so just bear with me right now. Okay, so I've got my patient in the position. I'm going to go ahead and open my kit. So you're doing the 1-inch borders. I've got my gloves right here. I'm just going to put them to the side. So I'm going to go ahead and grab my little drape, shiny side down, 1-inch borders. I'm going to actually fix it real quick. And the 1-inch borders. I'm going to flex it right here. And I'm just going to put it right there, and I'm just going to fix it real quick. Doesn't have to be perfect. Okay, so I'm going to go ahead and, I have my clean gloves are off, and I'm going to go ahead and put my sterile gloves on. I'm going to give me some room over here. Okay. And I'm going to pull away from my skin because you don't want to touch it and it actually doesn't want to go on. So I'm going to go ahead and move on to the other. Going under. And then I'm going to fix my other one since I have my glove on. Pulling away from the skin. Okay, so I've got that, and I'm going to stay above my waistline, and I'm just going to go ahead and drop that to the side. Okay, so I'm going to give myself some room, so I'm going to put it right there. And I'm going to take this little box, or this little tray out and put it to the side right here. Okay, so I've already opened my swabs, so I'm going to go ahead and put this in the box right here to the side. And I'll just drop that to the ground. I'm going to go ahead and drop this since I won't need it. So I've got my lubricant right here, and I'm just going to put it in this little corner right here. And got my syringe. I'm going to go ahead and attach that right here. And I'm going to place that into the box. And being very carefully, I'm going to wrap this around my finger. Because you don't want it to fling everywhere. And I probably just broke sterile field just touching that. But I'm going to drop that to the side. And I'm going to place that back into it. I'm actually going to place it into that lubricant. Okay? So I'm going to move my, I have to keep touching my laptop because it's going to turn off. I'm going to move my box to the side over here, giving me some room. It'd be different in real life scenarios. Okay, so I'm going to tell my patient that I'm going to go ahead and clean that area real quick before I insert the catheter. Is that okay? Okay, she said it was okay. So I'm going to use my non-dominant hand. And I'm going to grab one of the swabs right here, and I'm going to go away from me, and I'm going to go to the side and drop it. I'm going to grab my second swab, and I'm going to go to near me, down to the side, and I'm going to grab that last swab, and I'm going to go down the middle, and I'm going to go around. Okay, so I am going to grab the catheter. I'm going to let my patient know that you're going to feel some pressure. Okay, and some discomfort. So I've got that lubed up. I'm gonna give myself some room over here. And I'm gonna go ahead and insert. Okay, so I'm inserting, and I see some urine, but for a woman, you're gonna go 1 to 2 more inches in, and then a male, you're gonna go 3 to 4 inches. So then I'm gonna hold that with my non-dominant hand, so everything is clean now, not sterile. I'm gonna inflate the balloon. Okay, balloon is inflated, and I'm actually going to remove the syringe and put it to the side over here. And I'm going to tug. I'm going to tug and make sure that is in place. Okay, so I'm going to take this out, and I'm actually going to move this to the side. And I will take my sterile gloves off, put clean gloves on, and then I'm going to attach it, leaving some room. And I'm going to attach it to the side of the patient's leg with the strap, and I'm going to hang it on the side of the bed, but not the side rail. Okay, so we're going to pretend that that's hanging. Okay, so that is for inserting the Foley catheter. Okay, so for removal, I'm going to say, knock, 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 hi, I'm Hannah. I'm here to remove your Foley catheter. I'm going to do the same thing, wash my hands and provide privacy for us. Okay, so am I allowed to touch you? Okay, they say yes. So I'm going to go ahead and remove your catheter. Okay, so then I'm going to take it off the side rail. I'm going to take it off the strap. I got to bring my 10 milliliters syringe with me. And I can have clean gloves for this part. So I got my clean gloves on. And I'm going to attach the syringe, and I'm going to deflate that balloon. I'm going to say, can you please bear down for me like you're pushing? Okay, so I'm going to go ahead and pull that out. Alrighty, and then I will just discard everything.